Paul Seegert for PCS Advisers really is a kind of a breakout form to the benefit of having free market ideals and still a semblance of capitalism we can go to. Paul, thank you so much for coming on. How are you?
Great. How are you today?
Well, when I saw that the Democrats had a new health care plan, I said, well, for sure, this is going to really benefit those companies that paid the politicians, but not too much the people. Was I wrong?
No, you're right. When we look at how the Affordable Care Act has worked out for insurers, they and large hospital systems are the only clear winners. They fought it tooth and nail when it was being proposed, and then when it's been most recently challenged before the Supreme Court, when you look behind the curtain and saw who was submitting briefs in support of the Affordable Care Act, it was the large insurers, the five that are left in this oligopoly that we now have that runs healthcare.
Are you surprised that the American people, it's been 11 years, and not only have they unsuccessfully tried to remove the yoke of tyranny of government healthcare, it looks like we're going to really double and triple down on it. And is there any bright spot? Do people have any cause for optimism?
Well, I would say so, yes. We're seeing employers fixing it every day. They're the only stakeholders, I say all the time, they're the only stakeholders who have a reason to fix it. They have to turn a profit. They can't simply borrow or print money to pay for something that is overpriced and declining in value every year. They have to make those numbers work, and they're not all high-profit industries like the Facebooks of the world. You look at, there are some very large corporations who have a per-employee per-year profit that could easily get wiped out by the cost of healthcare alone. Big names like Walmart that maybe only have $12,000 or $15,000 per employee per year profit, and the average cost for healthcare now per employee is more than $15,000. So if they don't manage it, it could literally make the difference between being profitable and not being profitable.
So the Democrats have a new health care plan where they're going to, Obamacare has failed so miserably and is so ineffective that government only has one idea, and let's expand it and let's fund it more. And I don't know anything about it, but I'm guessing that's what it is. Could you fill me in on exactly what it is?
Yeah, what they're trying to do, they're frustrated that there are still some states that have held out against the Medicaid expansion that was part of the ACA. And those states did so because not all of the costs of that expansion were covered by the federal government. They did cover the lion's share, but it left them in a position where states who did the expansion are oftentimes, it's the largest line item they face, is the cost of Medicaid in their state. So it may sound like, hey, they're only shouldering a small percentage, but in terms of real dollars, it crowds out other priorities like education and other very important things. So they're frustrated that you have these 12 holdout states. What they're trying to do is go around the states, give money to the insurers to subsidize the ability for those, it's largely childless adults who, without work requirements, that kind of thing, or that they want to extend this coverage to, and they're looking to give subsidies to the insurers to do it. And of course, the insurers are understandably excited.
There was a 60 Minutes a few years ago that did an expose on how Medicare and Medicaid are victims of billions upon billions in dollars of fraud. For the most part, the way that I view it is that they are absolute and total failures. I do not see them as a benefit to society. Yet, we hear 50% of our society demand that there be Medicare, Medicaid for all.
Right.
Why do they think it's a winner? Can you explain this to me?
Well, I think that we have to be honest in this conversation and realize that lobbyists are very powerful. When will healthcare get fixed in this country from the top down? That'll be the day that lobbying is not very effective anymore, which will never happen. And you look at the hospital rule, transparency rule that kicked in January 1st of this year as an example of that. You have a big press event. We're going to bring transparency. Someday you'll be able to consume healthcare like you do just about everything else in a competitive way on cost and quality. or at least that's the goal, that at some point we could get there. And then you fast forward 10 months into the process, and it was part of the original ACA. They fought it in the courts for 11 years, one of the few good parts. So we fast forward to today, only 6.5%, this is I think a week old from the Wall Street Journal, 6.5% of hospitals are actually complying because, as often happens, in the implementation of the rule, lobbyists get involved. The maximum fine they face for noncompliance is $300 a day, and they have multi-billion-dollar balance sheets in many cases. It's not even a rounding error. It's budget dust to these folks, so it's just a non-issue in its implementation.
This is all very disheartening because I was hoping that through time, people would demand that we go back to a system that really benefited those people who partook in it. We now have been forcing people to go under this new fix, which is really a failure. And aside from people who are doing concierge, many businesses, I know this because it was actually a factor with me. I was paying $2,200 a month, and it was more than my first mortgage was. It was destroying so much of the quality of my life and really controlling some business decisions I made. Is the concierge aspect of healthcare taking off the way I wanted it to, or is that being crushed under regulation and penalty of freedom?
It's really not taking off the way that it could because it's a threat. It's a real threat. What you have is large hospital systems and large provider groups buying up small players and buying up primary care doctors primarily. It's virtually impossible, if you're not going to do the concierge model, it's virtually impossible or very difficult at the least to run a profitable business as a primary care doctor anymore. So then they end up selling to the big hospital system in their area, and then they get turned into salespeople for them because then they have rules. They have to refer these people off to the specialties. So they're a doorway then to getting these patients as quickly as possible to specialties where real dollars get made, where real billing happens. And so it's not primary care like we knew it when it started. It's not your small town physician or your local doctor who's helping you stay healthy and guiding you through your life and teaching you about how to live healthy and spending time with you. This person is now governed by their compensation model to crank through as many people as possible and kick them over to the specialties. So that's really the evolution that we've seen, unfortunately.
They passed the law that we had to pass to find out what's in it. I read a few months ago that there are still some aspects of the original Obamacare that medical professionals and hospitals and insurers are still learning of. Do they still know what's in the first one before they pass the second one? Are they still learning of the mechanisms that were hidden in the multi-thousand-page bill?
Well, the thing is, it's so complex that it really gets sorted out when it's by people in the government who are not elected and did not write the law and so on. So you have Health and Human Services in these parts of the government that then interpret the law and create the day-to-day rules. And there's a lot of room for their interpretation. And that's how we see this thing evolve over time and get us to a place where if we take a step back, I was asked today, what's the report card for how we've done in the last 11 years with the Affordable Care Act? And the answer is deductibles are up 87%, premiums are up more than that, and we have $141 billion in medical debt being held by insured Americans. That's our report card. So clearly we can do a lot better than that.
When you see that the infrastructure bill, the reconciliation, what it's really going to do is expand this idea of human infrastructure. And what they're really talking about is backdoor nationalization of all kinds of healthcare and doctors in the future. Are you optimistic 10 years, 11 years, 15, 30 years from now in healthcare in America?
I am. And I'm seeing reason to be optimistic on a daily basis because employers are fixing it and it's moving down market. It's very difficult to find an employer today that has 5,000 plus employees, it's almost impossible to find an employer that fits that category that's buying their health care retail anymore. They're most likely working with a consultant who is working with them to manage the actual cost of health care inside their health insurance, inside their health plan. And by doing so, they're getting better results. And that is moving down market now, where even employers with hundreds of employees, you flip a coin, and you've got a 50-50 chance, basically, of that employer is still buying retail, or could be in a more custom arrangement where they're working with a consultant who's aggressively helping them lower the cost of health care. One big obstacle to that is the fact that as we continue to expand government coverage, and kind of part of the untold story is that these government plans do not compensate providers and hospitals nearly as much as employer-sponsored plans. And so then it creates this system where the employer-sponsored plans have to be overcharged to compensate for the underpayment that's getting received from the government plans. And that's an untold story that doesn't get talked about much. But you have you have an inequity there that's shifting costs to employers, and it's driving up their costs wildly. And we have to resolve that. It's not enough to just expand coverage and dictate that you're going to pay a hospital less than they require or need to actually keep that person in that bed, knowing that you can make up the difference on the employer, the person who has an employer plan in the next room. We need to have those plans paying a reasonable reimbursement to these providers.
And PCS Advisors can help employers navigate these costs. You have some
absolutely
concepts.
That's what we do on a daily basis.
Paul Seegert, PCS Advisors, and is it PCSadvisors.com, Paul?
It is ERS, not ORS. PCSadvisors.com. We're easy to find there, and we're working hard to be a positive voice for change in the way that we all pay for health care, because it has gotten really far off track.
Paul, I feel better that you're out there, and I wish you the best for all of our sakes. Thank you so much for doing what you do. I appreciate it.